their body also became sensitive to insulin. So their insulin insensitivity went down. In other words, their insulin became more efficient. Welcome to Day Spring Life and Health channel. All right, so in the previous video, we talked about what to know or how to tell you are deficient in vitamin D. Today, we are actually going to talk on a topic that I have entitled, Can Vitamin D Help Prevent Diabetes? Can vitamin D actually help prevent or even make diabetes cured? All right, so let's get to it. So studies have shown, and it is a well-known fact out there, that vitamin D improves what we call insulin sensitivity. So let's talk a little bit more about what insulin sensitivity is. So in type 2 diabetes, some people in type 2 diabetes do have enough insulin, all right? They are able to supply the insulin amount that they need, produced by the beta cells of the pancreas to control high blood sugar levels. And yet they still have type 2 diabetes, which basically means that all the insulin they are producing do not work. They do not work as they should. And that in itself is what we call insulin insensitive. So if you are producing the insulin and yet the insulin is not working, then there must be something wrong with either your body not sensing the insulin, or if the insulin itself is not working, if it's not good. But what it is the insulin is still good. It's just that your body is insensitive to the insulin. And that is where vitamin D comes in. A study that was published in the European Journal of Endocrinology suggests that vitamin D supplementation, for some time, it's able to boost your vitamin D levels high to the point that those who have diabetes, not only do they feel better, but they are able to control their sugars. So their insulin become more sensitive. The same would work for somebody who is also type 1 who is using insulin. And the study actually focused on a treatment duration of 6 months. So people were provided vitamin D supplementation, or they were provided vitamin D supplements for 6 months. And in that 6-month period, what they found was that their beta cell function, or the cells that produce insulin, became better. They began to work better. And not only did that happen, but their body also became sensitive to insulin. So their insulin insensitivity went down. In other words, their insulin became more efficient. They began to work again like normal people. And so this suggests that if you take vitamin D supplements to the levels that are safe enough for your body to handle, then you may be preventing diabetes from happening. Now, if you have diabetes already and you took vitamin D supplements also in a safe amount, then also you would be improving your body's ability to produce more of your own insulin. And not only that, you would also be able to have a better insulin working for you. Your insulin will begin to work better because your body becomes sensitive to the insulin that you produce. And in the study, the suggestion for the amount or daily amount of vitamin D supplements that is used is 5,000 international units. Now, I'm throwing this number out there. I'm not just saying that go and get 5,000 international units of vitamin D daily, but you know yourself, if first of all, you can ask your doctor and see how much vitamin D you have, if your levels are in the normal range. And then also, if you have very good sources and diet sources of vitamin D, you may not need to take an additional amount like 5,000 international units to supplement. So it all depends on, one, how much you have already, or how much your levels are, and two, your diet, how inclusive is your diet with vitamin D sources. And then after that, then you talk about how much to supplement, and you can work this out with your doctor. I think the baseline is to know how much you have already on board, then to see if you need to supplement. This study and others do suggest that insulin sensitivity improves with vitamin D supplementation of 5,000 units per day, and it also helps with your pancreatic beta cell function. Your pancreas begin to work better, producing more insulin for your use. So that is those 2 points that we want to highlight in this video. We also want to add to it that apart from the fact that insulin, vitamin D is going to help with diabetes and potentially prevent people from ending up in diabetes. Diabetics are also prone to infections. Diabetes, if you have diabetes, especially in advanced diabetes, people usually become sick easily. That is what we mean by prone to infections, because the immunity or the immune system is weaker than the people without diabetes. So in order for you also as a diabetic to also definitely do better, not just with the insulin levels becoming higher with beta cell function, and not only with the sensitivity we're talking about, vitamin D has also been known or is known to boost your immune system. So if you are diabetic and you are not on vitamin D, you definitely need to ask your doctor and see if it is good for you. You can start off with improving your diet sources or the other sources you can take vitamin D from, or check your levels with your doctor just to see how much you need to take as far as vitamin D supplements are concerned. All right, thank you for hanging out with us in today's video. Click the like button if you found this information useful, and share with friends, and check with us again next time. We are also live on Sunday evenings with a live show on a range of topics that include health and wealth. And beloved, we wish above all things that you prosper and be in health, even as your soul prospers. Thanks for watching.